Hello and welcome to this learning module on nutrition advocacy. This module has been created collaboratively by the registered dietitians listed here. The purpose of this module is to provide a broad view of national legislation and how it will impact the public provision, education, and safety of nutrition delivery. As a registered dietitian, knowledge about how your patients or clients might be impacted by legislation and food policy is essential to professional practice. This module is intended for use for all registered dietitians. However, if educators use for student learning, it will help fulfill the competencies for dietetics education that are listed here. The following topics will be covered in this module. At the end of this module, you'll be gaining a better understanding of what is advocacy, how bill becomes a law through the explanation of the legislative process, a review of popular federal nutrition programs and services, some strategies on how to be an effective advocate, and then finally there will be some learning activities and action steps to help you apply what you've learned along the way, along with some references and resources. Prior to starting this module, please log into your eatright.org account, as many of the links provided will direct you towards your Eat Right Pro account, and that way you can follow along. So here's our first discussion question to share with your peers or your colleagues, or just to ask yourself. Why do you think it is necessary for an RDN to learn about advocacy? So let's check in with Austin Kahari and Sharon Banta, who are both registered dietitians and are having a discussion on why we need to know about nutrition advocacy. Please view this 20-minute discussion from these practicing dietitians.
So I'll let you go first. Hi guys, my name is Sharon Banta and I'm a DCN student. I currently work as an outpatient dietitian. And I am also an outpatient dietitian, but I work at the Wilkes-Barre VA, and I also work in outpatient dialysis. Like Sharon, I'm also a DCN student at UNF. So Sharon, today we're going to talk about a little bit about advocacy and why it's so important for our profession. And first, I want to talk about what is advocacy and why is it so important to our profession?
Definitely. So I learned a lot during this class. I think advocacy is a super important topic, and just to go over a pretty brief definition with you guys. So advocacy is an activity by an individual or group that influences decisions within social, political, and economic institutions. So some examples, Austin, of advocacy could be like public speaking, media campaigns, even talking to your friends about things that are important to you. So there are lots of ways that we can advocate.
I think that's a really good point, like just talking to your friends. It doesn't have to be a big, grandiose thing at first, just getting used to and comfortable with talking to people about important issues.
That's great. And then I also wanted to talk about lobbying, because that's a really important aspect of this whole topic. So lobbying is a form of advocacy that is made directly to legislators, and so it's usually on a specific topic. A good way that I like to differentiate between the two is to know that all lobbying is advocating, but not all advocating is lobbying. And it's really important for us dietitians to know that nutrition is for everyone. It has nothing to do with what political party that you're in, but it's important for us to start to say something.
I think that's so important. Like you said, nutrition is literally for everyone. We all have to eat and have nourishment. So let's talk a little bit about the why. Why is it so important? I mean, we are the experts, right? We are the dietetic professionals. So it is our duty to raise awareness, influence, and change policies that we see that are not working when we work with our patients every single day. We represent people who might not be able to speak for themselves. While promoting health and well-being positive lifestyle changes. I think a lot of people don't even recognize that this is what we do. We don't just sit around and write meal plans. That drives me crazy. So we do encompass a lot of these, and we kind of are the glue, I would say, like in the medical community between like social workers and physicians. We work everywhere, right? We work in private practice, physician offices, clinics, nursing homes, fitness centers. I mean, you name it, and a dietitian can probably work there. So we have very diverse settings, and I think it's important to know, well, my friend Sally can't just be the one advocating for me. She's a dietitian. She seems to be out on the front lines doing a lot. I'll let her do it. Well, her specialty might be very different than my own.
Great point. Yeah.
Her perspective, she will advocate for me. She'd gladly advocate for me, I'm sure. But she just doesn't have that unique perspective. So if not like me, then who? Like, who is going to do it? And I think it's really important for us to adopt that mindset. And Sharon, I know you probably have many examples of why advocating is so important for our patients. But what about advocating for ourselves?
That's such an important point, Austin. I definitely want to start by talking about us, the registered dietitian. We're always out there taking care of others, but I think it's really important for us as a group, as a community, to start standing up for ourselves. It's one of the reasons why I selected this DCN program, is because of the emphasis on leadership. And we don't have a union in our profession like a lot of other professions do, like nurses and things like that, to kind of back us up. And so as a whole, we are overworked and underpaid. And this is always my tagline, you know? It's like, we need to see something, say something, because we're the only group that pays for an internship. That was right. And then by the time we finish our master's, there's no increase in salary, and same thing with a doctorate. So it's really, really important for us as a whole, as a community, to start to be a little bit more bold. And so that way that, you know, our work supports our growth and then also our pockets. So I want to start by saying that. But that being said, we would be nothing without our patients. And I know that dietitians as a whole, we're very passionate about what we do. And so as an outpatient dietitian, I'm the lead dietitian at the clinic that I work in. They're core sites, and I'm in the main site. And so one of the things that I have to do, believe it or not, is on a daily basis, I have to actually advocate to go ask the doctors for patients to be sent to me, because they're so busy, it's so hectic, and so many times they don't understand the wide variety of topics that we as registered dietitians cover. And so it's very important for me to see something, say something. I go to the adult, the medical huddles in the morning, and I show up a little bit early and just kind of listen to the patients that are scheduled for the day and say, well, this would be a good selection to send over to nutrition. And kind of, it's like a script that we do again and again and again, but in that way, by showing up, nutrition is present, and then we have a seat at the table. So I think that's a really, really big part of it. A thing that I did to advocate for the dietitians during the pandemic was my site was not doing telehealth. Then at the start of the pandemic, it was very scary to have to go into work and then also have our patients come see us, very close face-to-face in small offices. So I advocated along with the other dietitians to ask for virtual sessions. Although we had to still go into clinic, our patients could be seen virtually. So that helped a little bit. And, you know, once again, nobody else was doing it. Front desk was doing normal protocol, sending patients in. But there is no reason why in an outpatient setting, patients can't be seen virtually. So once again, a lot of times if you ask, the answer might be no, but the answer can also be yes. So you got to see something, say something.
And it might be no first and then yes later. So
Definitely.
don't stop at no.
And I think, Austin, you know, the thing with both of us is we are second career dietitians, and that might help a little bit in this whole topic. Is I went to business school first, and what was your first major?
I was psychology, so it was very different.
Yeah, so we had to enter this whole science field, but I want to tell you guys, if you have a second profession, initial major that you started with, like, don't forget about that, you know, and use that as a way to advocate for yourself for the things that you're working on right now. Yeah. So Austin, do you have an example that you can share with us?
Yeah, I'll never forget my first quote unquote like success story, right? That first patient in your head where you're like, wow, like I'm never gonna forget the changes that they made. So it was a middle-aged woman, we'll just call her Mary. She had fibromyalgia. She Um, Fast forward 18 months, we sat down, we worked together, we met weekly at first and then monthly. But 18 months later, she was down 100 pounds on no medications.
Wow.
No longer on Lyrica, no longer on metformin. And she was talking about, like, she was doing these races with her husband. She was in her 50s. Like, she was not like a seasoned athlete or anything like that. And just to see how happy she was to be able to do this with her husband was just so incredible. And just to see her keep it off. So a few years ago, I actually ran into her, and she had kept that weight off, and she was doing wonderful. And I always come back to this in my mind. Medications aren't cheap, right? Like, I was looking up online. Fibromyalgia can cost up to $500 if you're paying out of pocket
Correct.
each month. And it boggles my mind that with MNT and billing, that you have to have either a diagnosis of chronic kidney disease or diabetes for you to be able to bill insurance.
Right.
And I'm just thinking to myself, how much money did she save, or her insurance company, right, save, because she was fortunate enough to be able to pay for a dietitian out of pocket. Not everyone is that fortunate to be able to pay for a dietitian out of pocket. And the rate wasn't cheap, right? It's $150 an hour. I think that's an important part for you too, right? We need to start charging more because people will pay it and we deserve it. But I digress. But she paid that, and that insurance company saved. So insurance companies should be looking at this. Actuary, right? Like, actuaries should be looking at this and telling insurance companies, hey. So I think even just not just supporting each other, right, but crossing the lines, like, what other professions can support us and show that we deserve this? Like, we need to advocate for ourselves, like you said, for billing, and then same thing for patients. They don't want to be on medications that long. Like, it is so great seeing her being healthy, active, and enjoying life. I mean, it's a huge difference.
A great story, and that shows the direct impact. It's such a good example of what we can do in our field. Food is medicine, right? So it's exactly just that. All right, Austin. So I know that we can go on and on about how great advocacy is, but what are some things that dietitians can do to advocate?
So, going to your congressman, going to your senators, right? Going to your state legislators. I think, one, it's very important to know the difference between the federal and the state, right? So there's different bills that might be with your state, with like state licensure, that you're not going to be going to your senator about. You'll be going to them about something like the Farm Bill or the M&T Billing Act or something like that. So being versed with what's going on. The Academy is a great resource for this. They have something called action alerts. So if you go on to the Academy of Nutrition and Dietetics, you look at the action alerts. You stay on top of what's going on within your field. I feel like sometimes we shy away from it because in our minds it's, like you said, political. But it's not political. It's trying to find solutions that have to do with nutrition and dietetics, and that is what we do. So it is basically our responsibility to know what is going on. Ignorance is not bliss in this situation.
Absolutely. I couldn't agree with you more.
And so, I mean, it's pretty easy, right, if you start off at the state level. Anyone, I mean, especially if you live in a small county like myself, but they're usually there, or one of the representatives they work very closely with are in the offices. I know some of our offices are just opening back up. The state legislators aren't usually in D.C. as often. They're usually a little bit easier to get a hold of. Even if you don't feel comfortable saying, hey, this is what we need and this is what we deserve, right? If you're a little bit more confrontation adverse, then say, hey, come shadow me. Come see what I do.
Yeah.
I was listening to a podcast of health coaches the other day, and they were saying that dietitians just serve the meals that the doctors write the order for. They don't even know what we do. So this
It's so frustrating, yeah.
so frustrating. And if this is what they are telling their state legislators, right? Who's going to talk for us? Pennsylvania, less than 5% of the population are dietitians. So who's going to advocate for us? It all comes back to, like, we have to raise our voices. We have to express our voices.
100%. And so that takes me on the local level. So just some basic things that So in New York City, that's the Greater New York Dietetic Association, and it's just about being in the loop, getting their newsletters, and they're always doing something. So just by picking one organization, it doesn't have to be a whole list of them, but just by picking one and committing to that, it at least keeps you up to date with things that are going on.
Even if you're reading that newsletter, right? Even if you're reading that newsletter and reading it, it's a good first start.
100%. It adds ideas into our brain. So, I mean, those are simple things that we can do. And I wanted to ask you, Austin, a little bit more. What are your suggestions on the practitioner level? How can practitioners get involved?
Right. So I think you had a great point, right? Like you go to the meetings early and you start talking to the doctors and letting them know what you have to offer. So letting people know our services, right? Marketing ourselves, marketing what we do and how we can help. I think a really great point is too, when you do have licensure, that when you go into like the ICU, right, or you're going into your PACS team, which is your outpatient physician, your primary care physician, you go to your huddle meeting, you should be the prescriber for nutrition orders, and you should take that stand. Don't say, oh, I think you should be doing this.
Yep.
Say, let's order this, and kind of hold our ground to let them know that we are the experts. We have to have the confidence within ourselves.
That's it, yeah. That's major. Confidence is huge. And so I wanted to add just on the community level. So some of the things that I do is I give out referrals to other people on the treatment team. So I'll ask social work to help my lower income patients get access to SNAP and WIC, because there are so many community programs out there to support nutrition. But once again, if we don't make that connect, then the patient might miss out.
Exactly. And I mean, you mentioned you're in New York City, right? So let's kind of talk about that global level, how we can advocate on the global level.
Yeah.
If you're going into clinic, when you were the hot spot for COVID within the United States for a long time. You were on the news every single day. It was a very, very scary time. So let's talk a little bit about that. Like, what can we do when there's a global pandemic? How do we advocate for our patients and for ourselves there? You mentioned for ourselves a little bit with the telehealth, but how do we advocate for our patients?
Well, when it comes down to it, it's also about making sure that the patients are taken care of. You had an example about vitamin D, right?
Yeah. Yes. So with vitamin D, we have found, it was actually very early on, I read the first article, and now it's pretty much known, and all the hospital doctors know this now, that vitamin D can, if you have adequate levels, you have less of a risk of having major complications from COVID-19.
Yes, it builds your immunity.
It builds your immunity, and you have less of a risk of being intubated. That's a big deal, especially when we're running at events and things like that. So what a simple test it would be to measure people's vitamin D levels. I saw an article saying that we're not supposed to be doing that there's no clinical evidence for that. But a blood test versus finding out later on, I would have to argue that. And I would think that more research should be done. So we can also direct where research goes. I mean, we're in a DCN program, right?
Yes.
We could go and run with this if we wanted to.
Yeah, you're right. We need to be the leaders of the next generation. And like you said, we'll have the confidence to do that. And I mean, this class taught me a lot about the different areas that we can get involved in and the power that we already have. We might not know we have it, but we do already have a lot more power than we think we do.
Right, exactly. And so, Sharon, what would your advice be for a dietitian who doesn't think that nutrition advocacy is for them, that they don't think that it's something that they
right? We have to be the change that we want to see in the world. So I think that's absolutely wonderful.
100%, 100%. Well, this was a good project. Thank you for taking the time.
And thank you, Sharon. This has been great talking to you.
Same, same. So, I would say I learned a lot in this class. What about you?
I would definitely do it. And I think one more point, just like advocacy is literally for any dietitian, right? Whether you just graduated and you still haven't even taken your RD exam, or you have been practicing for 25, 50 years and you've been grandfathered in and you don't need that MS, like you are just as important as anyone else who's in the profession. And I think that we need to have that confidence. And we are the professionals, we are the experts. I think that we can't forget that.
I love it. I love it.
Well, have a great evening, and thank you so much.
Thanks, everyone. Bye.
Bye.
I hope you enjoyed the recording from Austin Kahari and Sharon Banta. So let's continue with our discussion on advocacy and legislation. So just to summarize a little bit of what Austin and Sharon were talking through, every RDN should be aware of advocacy and the importance of being an advocate. So to review the definition of advocacy, this is the act of pleading for, supporting, or recommending. There's a link here if you'd like to learn more about the Eat Right website. But more importantly, we want to define also the advocate. First of all, you have advocate, so you can advocate or support or recommend something publicly. And publicly is the key word for this definition because it's something that you are speaking out about. You're also speaking in favor of something as well. You also want to be an advocate. So that is someone who upholds a cause and more importantly speaks on behalf of another who can't speak for themselves. So really, we had to answer that question of why do RDs need to learn advocacy? It's because we need to raise awareness. We need to influence change and change policy. And we also want to represent the individuals who cannot speak for themselves. And that really includes all of those clients, patients, our community, individuals where every RD can be found. And you know what we're talking about, RDs that are in acute care, long-term care, private practice, communities, school systems. We represent many variety of individuals. They also Austin and Sharon highlighted 3 types of advocacy. We can be practitioner level advocacy, where we are looking at licensure, for example, which is probably the most common conversation about practitioner level advocacy. So for example, if you were sick and needed medication, you would go to your primary care physician. You're not going to go to the person at the checkout counter at CVS. You know, this is the same example of someone going to a self-proclaimed nutritionist and those versus going to someone with credentials and education like the RD. So just as a surgeon is trained to perform surgery, we are the ones trained to provide qualified and perform medical nutrition therapy, which are proven, thorough, scientific evidence-based practice. And we know how to manage the disease as well as promote and prevent disease as well. The other level of practitioner advocacy is reimbursement, and there was a little bit of a conversation about that regarding reimbursement for all areas of MNT. Insurance companies recognize certain areas like CKD and diabetes, but there's a lot more to recognize in where the RD can serve. So try to remember that it's not only just the licensure, but we also want to be able to provide that evidence-based service to all of our patients, and we want that to be available for them, paid by insurance companies, so that they can come to the RD worry-free. So how could we get involved in the community level? Well, there is this is a large area to be an advocate for. There is many areas of nutrition education, policy for funding resources for those who are insecure, those that can be met, legislation that can provide services within the community. Some we're going to discuss in this module, for example, WIC and SNAP, that provide assistance to individuals, but also to local programs in your state. For example, the Louisiana State Agriculture's Smart Choices program, or Eat Right Philly in Philadelphia, Pennsylvania. Meals on Wheels and Feeding America, the Food Resource and Action Center. These all are programs that receive funds from legislation and serve your community well. And then how about the global level? Well, Sharon and Austin brought up some ideas about how the RD can be an advocate for areas brought to light by COVID-19, such as, vitamin D deficiency. But there are also things that have been brought to light with the pandemic of the disparities found with food access and healthcare seen in many populations that were at greater risk of COVID-19. This is an opportunity for us to address why RDs can make an impact to prevent those high-risk situations and also help improve food security. But global malnutrition also remains a very big problem throughout the world, and RDs can team up with other programs to help provide and promote healthful policies that could bring relief not only to our local communities but to our global communities as well. Feel free to take a look at the globalnutritionreport.org website that's provided here. So let's go on to our next discussion question, which would be, why do you think it would be necessary for an RD to know how a bill becomes a law? So now that we have a good handle on why the RD should be, quote unquote, at the table when policy or discussion occurs, it's really important to understand this question and understand and be able to answer this question of how does a bill become a law? Because that's a very important part of where we can fit in. So some of you might remember the famous Schoolhouse Rock video of "I'm Just a Bill," and maybe this is an opportunity for you to connect here. There's a link to the YouTube if you're interested. But it's a great thing that can give you a very short synopsis of how a bill becomes a law. But in the next few slides, we're going to go through the process, since to be an effective advocate, you want to be able to talk the talk a little bit. So let's start off by asking the question of, what is a bill? And the bill is a principal vehicle employed by lawmakers for introducing their proposals in the Senate or House of Representatives. Bills may address matters of either general public interest, and those are called public bills, or a narrow interest, and those are called private bills. And they are designated, the bills are introduced in the Senate and the House. If they're introduced in the Senate, they'll be given a number, and it'll begin with the letter S, and it will also then give a number. So you might have bill number S1 or bill number S2 and so on, depending on the order that they are introduced. Likewise, bills introduced in the House of Representatives are designated by the letters HR, like House of Representatives, and then also given a number as well. So an S bill or an HR bill will indicate where the bill is being introduced. And the numbers are retained throughout all of the parliamentary stages. So how does a bill get introduced? The bill is introduced in either the branch of Congress, so the U.S. House of Representatives, as well as the Senate. Any member of the House of Representatives may introduce a bill at any time while the House is in session, and they'll place it in what they call a hopper. The hopper resides at the side of the clerk's desk in the House chamber, and the bill is assigned its legislative number, just like we learned about, either S1 or HR1, or this is the House, so it would be HR. And by the clerk will be giving its number, and it's referred to an appropriate committee by the Speaker with the assistance of a parliamentarian. So they assign the bill over to a particular committee. Now there are many committees within the Congress, and based on what the bill addresses will determine what committee it is assigned to. So for a list of the committees and where the bills might be housed, feel free to click on to these two links. These are links into the Eat Right Pro website that will give you more information about the House and Senate committees where the bills may be housed. The bill is then printed in its introduced form and entered to a committee's legislative calendar. So it officially becomes part of the conversation. The member introducing the bill is known as the primary sponsor. Now this is important to know because when you know who the sponsor, and every bill will also have co-sponsors. The co-sponsors or the sponsor may be your local legislator. It could be somebody from your state, and in that case, you have a really nice opportunity to speak to that particular bill or piece of legislation. But those are some important information, is to know who the sponsor is and who the co-sponsors are. Also, any senator may also introduce the bill by submitting it to the clerks on the Senate floor. They may also use a more formal procedure by rising and introducing the bill from the floor. So both the House, the bills can be introduced in both the House and the Senate. So once the bill has been introduced, it will be up for debate, and these steps will be taken before the bill can be assigned and passed onto the House of Representatives. And this is all taking place while the bill is in committee. So there's going to be a public hearing where the committee members will hear the witnesses representing the various viewpoints on the measure. This is a really nice opportunity for them to hear from their constituents. That's you and me that live in their area. And that's a great opportunity and great timing for us to speak up. After the hearing is completed, the bill is considered in a session known as the markup session. And at this point, members of the committee study the viewpoints, present in detail. They offer amendments to the bill. They'll vote and accept or reject those changes. And at the conclusion of the deliberation, a vote of committee and subcommittee members is taken to determine what action to take on the measure. Now, if the committee votes to report a bill, the committee's report is then written. So, quick knowledge checkpoint, number 1. So, who can introduce a bill? And if you want to, you can click and find the answer that you feel is correct. If you click here, you'll see there are a few opportunities here. The House of Representatives and the Senate can. So if you chose A and B, you are correct. Both the House of Representatives and the Senate can introduce a bill to begin a process of being eventually a law. Organizations such as the Academy for Nutrition and Dietetics can show support of a bill that is being introduced to the House and Senate, but they aren't the ones to introduce it. The USDA is a federal organization that will oversee and manage many of the funded programs by federal law, such as one example is the Farm Bill. So here's another question for you. In what ways can a bill be introduced? Looking at the questions here, how would you answer? If you answered A, B, and C, you are correct. A bill, all 3 of these steps can officially bring a bill to the floor of the House or the Senate for discussion and approval. The committee chairman is not assigned until after the bill is introduced and assigned to a committee. So let's keep going. The following 4 steps are the process a bill now must follow if it's out of committee. So once the committee has reported the measure, it can now be considered for debate by the House of Representatives. So it comes back to the House and a debate begins. After debate concludes, amendments are decided upon, the House is ready to vote on its passage. If no, changes will be recommended, and then votes on a final passage may be taken by an electronic voting system. Now these votes are referred to as yay or nay votes, or a recorded vote. Once the bill is passed, it goes on to the Senate for final approval, and then if it passes the Senate, it will be sent to the President. So in brief, in order for a bill to progress to the Senate, there will be a debate, a vote, changes recommended, and then a decision of a yay or nay vote. If it progresses to the Senate and the Senate changes the language of the measure, then it must return back to the House for additional changes and then sent back to the Senate for a final approval. It's at that time when it will be sent to the President. So a bill will officially become a law when the President approves, but you can also become a law if the President fails to return it with objections to the House in which it originated within 10 days while Congress is in session. Or it can become a law if the overriding of a presidential veto by a 2/3 vote in each House. A bill does not become a law without the President's signature if Congress, by their final adjournment, prevents its return with objections, and this is known as a pocket veto. So, now that you've had some refresher on how a bill becomes a law, let's check in with Congress now. So, click on the congress.gov link here, and this will provide access to a current legislation that is being discussed and voted upon at this time. So if we click on congress.gov, and once we will do that, it'll take us to a web page. Here we are at congress.gov. If you come up to the search box and you type in medical nutrition therapy, you'll see that a few bills will show up with that information. So the first two that you'll see is H.R. 1551. So you know that this bill originated in where? The House of Representatives, right? For H.R. This particular bill, which is originated in the Senate, 584, is a big one. This is the Nutrition Care Act of 2021, and this is the one that's going to provide a lot of, we hope, will cover more nutrition services through Medicare. But both of these are currently being discussed or being they both were, introduced. Because the things that you can get from this website here is the name of the bill, and if we clicked on this, you can read the whole entire narrative of the bill itself. You also will find the sponsor. As we know, it's from a sponsor from someone from a Democratic representative from California. This bill also has 27 co-sponsors. You know the committee that it is on, and as well as the latest action. So if you look at the tracker, you'll see that currently this bill has been introduced. Both of them have. And you'll find the tracker of once they are passed through the House and go to the Senate and to the President, and then when it becomes law. So this is a great location for us to be aware of what current laws what current bills have been introduced, and to help get the status, as well as who the sponsors are and who the co-sponsors are, so that we can keep our advocacy more direct. So coming back to this slide, you'll see that you can check updates, and in the example that we saw was H.R. 1551. We also could see the sponsor, the committee that it was assigned to, as well as where the bill is currently in terms of the tracker. Is it been introduced, or has it been in the Senate, or is it with the President, etc. Now, the other step that you can take to get an idea of where current legislation might be is to take a look at your local area and your state itself. So what legislation is active in your state? The process of a bill becoming a law goes through this, it's the same process in the state. So in order to get an idea of what the current bills that are being discussed in your area is, you can click on the state legislative tracking map, which is found at eatright.org, or you just click on this map, and this will take you to a map that you can then click on your home state, and will provide you information very similar to what you saw at congress.gov, a list of bills and where the discussions are at current. And it also gives you the names of senators and representatives that you can contact. So take a few minutes and click on your state legislative tracking, the state legislative tracking map, and see what current legislature is being discussed in your state now. So finally, when a bill becomes a law, a primary avenue for exercising Congress's power of the purse is through the authorization and the appropriation of federal spending to carry out the government activities. So we need money in order for some of these bills that become laws to then be carried out. And that's what appropriation and authorization can do. The Authorization Act will establish federal agencies or programs. They'll decide which agencies and programs will carry out the law. It will also indicate the terms on how it should operate. Authorization also provides guidance on the appropriations, or in short, how the money should be spent as part of this law. The Appropriations Act will outline the distribution of the funding, if funding, and also if the funding is necessary, and this can also provide funding every fiscal year, or it can be indefinite longer. So appropriations are a very important step in order to get the funding and the money distributed. So for example, there is H.R. 133, is a Consolidated Appropriations Act 2021. That Appropriations Act included appropriations for nutrition provisions for needed nutrition assistance to fight hunger. This act would fund all the federal government departments and agencies through September 30, 2021, and as well as provide an additional $900 billion in COVID-19 relief funding. To learn more about how the appropriation bills and spending work, along with what the Academy consider priorities, click on how the budget process works in this box. Here's another question for you. At what point of legislation is advocacy most effective? When a bill is being introduced to the House, when a bill is being introduced to the Senate, when a bill is up for reauthorization, or when the bill is in committee in the House or Senate. You had a little bit of a trick there, as a star was lit up already, but all of them are correct. So if that's what you were considering, you are right. All of these parts of where the bill becomes a law are important steps for the RD, and they're also important steps for where your constituents, or you and your communities, should be getting your voice heard to your local representatives. So now that you have a good handle on legislation, we're going to step into some key nutrition programs and services that help many individuals across the country. The following discussions are going to be 4 popular nutrition programs that provide assistance, food assistance for specific groups. The Farm Bill, which houses popular programs like SNAP and SNAP-Ed. There's legislation that addresses child health, such as the National School Lunch Program. There's Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. And then the Older Americans Act, or OAA, which provides nutrition services to our older adult population. So let's first look at SNAP, or the Farm Bill. And SNAP is the Supplemental Nutrition Assistance Program, which was formerly known as food stamps, and its intent is to serve low-income individuals. The most recent Farm Bill was signed into law in 2018 and is reauthorized every 5 years. SNAP is part of the Farm Bill and is housed within the Farm Bill and provides monthly resources to low-income individuals who are eligible in the purchase of food and groceries. In order to determine if you're eligible for SNAP, you may apply in the state in which you live. And the eligibility criteria you'll find here in the link here for individuals, for your individual state criteria. Let's learn about get a little overview of SNAP and the services it provides by watching this video.
What do you need to make it through a day, a week, a month, through work and school, and life's many surprises? It's a complex equation with many factors. But let's back up. How do you take on that full day on an empty stomach? For countless Americans, 1 in 6 to be exact, hunger is a reality, and circumstances like job loss or illness are leaving more and more families struggling to make ends meet. Plus, hunger is often a silent battle. One fought while taking on the daily challenges we all face. So, let's do some subtraction on this problem. What is the way out of hunger? One important way is through SNAP. SNAP stands for Supplemental Nutrition Assistance Program, but you might know it by its former name, food stamps. SNAP benefits help over 47 million Americans fuel up so they can move up, providing benefits that are timely, targeted, and temporary, and that's a plus. For many of us, friends and family are our first line of defense in hard times, lending a helping hand and providing critical support. But what do you do when you don't have that network? Think of SNAP as that friend, a place to turn for temporary support, a way to enable success, encouragement to move forward, one step at a time. In addition, SNAP is flexible and responsive for life's toughest times, evolving easily to address things like recession or natural disaster, and empowering individuals to overcome life setbacks and be back on their feet, a turnaround that tends to happen quickly. We know the average household rotates off the program and are back on their feet within a matter of months. And nearly half of SNAP recipients are children, and Americans can count on SNAP to get it right. The program has a 96% accuracy rate, considerably higher than other federal benefit programs. That's because it's simple. Participants shop using a debit card, set up exclusively for purchasing food items. Items like fruits, vegetables, cereal, and baby formula. And in this case, what's good for our neighbors in need is good for the entire community. When people use SNAP benefits, it generates a significant economic impact, from farm to factory to store to table. And providing food and fuel to families doesn't just help them find a way out, it's also an investment in our country's future. SNAP benefits are proven to bridge a critical gap, strengthening communities and creating opportunities to take hunger out of the equation for good. For more information on the role SNAP plays in helping to fight hunger, visit feedingamerica.org.
SNAP services are invaluable for individuals who need help during times of need. During the COVID-19 pandemic, there was a significant increase in SNAP recipients, and thankfully funding was increased and provided to support this necessary provision. SNAP Ed is another program provided to SNAP participants and is valuable in reaching children and adults with vital nutrition education. The goal of SNAP Ed is to educate patients to make healthy food choices with limited budget and to choose active lifestyles consistent with the dietary guidelines for Americans. The RDN, the DTR, and other nutrition professionals play a vital role in the SNAP education efforts provided by SNAP Ed. This program partners with the USDA Food and Nutrition Service, the National Institute of Food and Agriculture, and the USDA Economic Research Service. So here's a task for you to consider. Have you ever thought about how it would be when limited to a strict budget for your monthly groceries? Many individuals do not. As a practitioner who will be working with individuals who need SNAP, we challenge you and to challenge yourself to take a walk in their shoes for a short time. An average daily amount is about $4 a day to spend on groceries. Using the amount, see how much you can stretch the grocery bill. Only prepare and consume food purchased allowed with SNAP and within your budget. Account for the cost of any food provided to you by friends or family, or don't accept any extra food from others in order to assure that you're getting the true effect of what a $4 a day budget feels like. And then recruit a friend to join in and share your experiences. If you need more information or you would like to take up the challenge with your peers, click on the link here that's found in this website, on this website. So the U.S. Congress passed the National School Lunch Act in 1946, and this was after an investigation revealed that the World War II Army recruits with poor health were rejected due to poor nutrition in childhood. The program has grown since then to provide 5 billion meals annually, operating in more than 100,000 institutions in all 50 states. The National School Lunch Program, or NSLP, provides nutritionally balanced, low-cost or no-cost lunches to children each school day in public and nonprofit private schools, as well as residential childcare institutions. The National School Lunch Program was expanded in 1975 to provide low-cost or no-cost breakfast, and many programs also have after-school snack programs. Programs are funded by the U.S. government, and schools are either reimbursed for food preparation costs or they receive free or low-cost food surplus low-cost surplus foods. Students qualify for the program based on family income, but pay with their school ID cards without the stigma of receiving support subsidies. The next program is the Special Supplemental Nutrition Program for Women, Infants, and Children, as well as we know it as WIC. This is the next highlighted program, and the purpose of WIC is to safeguard the health of low-income women, infants, and children up to age 5 who are at nutrition risk, and providing targeted nutritious foods to supplement their diets. They also are provided information on healthy eating and referrals to additional health care. The WIC program is administered by the Department of Agriculture in cooperation with state agencies. WIC specifically serves the category of pregnant, breastfeeding, non-breastfeeding, postpartum women, infants, toddlers, and children under the age of 5. The income requirements range from 100% to 185% of federal poverty income guidelines and vary based on state standard income levels, the family size, and the health risks. Children may qualify based on health risks such as anemia or them being underweight or having a poor pregnancy if they present with at least one medically assisted risk factor on the WIC health risk list, which is often identified by a physician, nurse, or nutritionist in the WIC clinic. WIC recipients must live in the state of application, but the applicants, such as the parents, grandparents, or guardians, can live elsewhere. Now, WIC is reauthorized every year under Section 17 of the Child Nutrition Act of 1966 and the Health Hungry Free Kids Act of 2010. This slide details service information for WIC programs. There's about approximately 6.87 million people received WIC benefits in 2018, 5.23 million of which were infants and children. Average monthly benefits range from $50 to $150. Typical foods covered by WIC benefits usually include peanut butter, canned tuna or salmon, eggs, fruits and vegetables, baby food fruits and vegetables, lactose-free milk, and dry evaporated milk. Let's take another look about this short video outlining WIC program specifics from a program that is in Wisconsin.
Funded by the United States Department of Agriculture. People who are eligible are women who are pregnant or breastfeeding or have had a baby in the last 6 months, their infants and children under the age of 5. In order to be eligible for the program, they have to meet income eligibility criteria based on 185% of poverty for family size. When people come and visit the WIC program, we pre-screen them for income eligibility. We'll check things at the front desk, identification, address, income, and then we'll do a brief physical screening where we measure and weigh the participants, and also some of the families do have finger stick for iron. And we also coordinate with the public health department to do some lead screening. You'll see what we call a competent professional authority with WIC. It will be a registered dietitian or a nutritionist or a nurse who will review a series of questions with the family, look at those lab results, and come up with the health or nutritional reason that they can be enrolled in WIC. We assign a food benefit for them, which contains a multitude of foods based on nutritional value and what the nutritional needs of that participant are. During the growing season, we also are able to offer an additional benefit for shopping at the local farmer markets and stands to promote locally
curriculum produce, and that provides the family an opportunity to have this nutritious food. With the families that enroll in the program, we do try to connect them with various community resources through formal and informal referrals so that they're aware of other things in the community or within the department that can be of help to them, such as car seats and vaccines. And one of the main referrals that we do in our own agency and program is to our breastfeeding peer counselor program. We have a peer that works with us. We would encourage women to meet with the peer prior to the delivery, and then she is available to answer questions and work through issues after the baby is born, including going back to work. Every family is issued a card that becomes their ID for coming to follow-up visits with us, but it also is the way that they shop for their WIC benefits at grocery stores and pharmacies. People can self-refer to the program, but if families know of someone that they think could benefit from being on the WIC program, they can just call our office and we can start an application over the phone. Phone numbers for our Oshkosh site are 232-3350, and for our site in Neenah, it's 729-2945. And you can learn more about the WIC program by going on the website, which is www.winnebagopublichealth.org.
So I hope that was helpful in understanding a little bit more about WIC. The last program we're going to talk about is the Older Americans Act. Congress passed the Older Americans Act, or OAA, in 1965 in response to concern by policymakers about a lack of community social services for older persons. Today, the OAA is considered to be the major channel for the organization and delivery of social and nutrition services to this population. Title III of the OAA is the largest funding source and provides grants for state and community programs. This title lays out responsibilities and requirements for state and area agencies on aging. It is through the programs and structures established by this title that most of the money is authorized and most of the legislative detail can be found. The most common services that Title III provides funding for are adult day services, and this is a community-based group program that is designed to meet the needs of functionally or cognitively impaired adults. They're structured, comprehensive programs that provide a nice variety of health, social, and other related support services in a protective setting when family caregivers may be working or away from their home. Alzheimer's education is another program that Title III of OAA will provide, and this is a service to those who have Alzheimer's or related dementia, as well as their caregivers and family. Education, counseling, and supportive services are provided, and that will enable them to cope with various stages of dementia. Examples of services could be maybe a seminar or support groups or some more education. Caregiver support and education is a program that provides support to families and caregivers of older adults, including access to community resources that fulfill unmet needs. So examples could be education sessions, counseling, advising in a group setting, and more. Congregate meals are a way to provide safe and nutritious food in a group setting, and this is a great program to address the nutritional health of our older adults. This program is designed to sustain and improve participants' health, nutrition health, but also reduce isolation through socialization and an opportunity for them to combine with their peers. Home-delivered meals, the goal of this program is to sustain and improve participants' health by providing safe and nutritious meals delivered in a home setting. The most common home-delivered meal service is Meals on Wheels, is probably what most communities will have. But this directly improves outcomes related to food insecurity commonly found in the older adult population. Some other Title III services include transportation, which can help move eligible individuals to and from community resources, get them to activities through use of a driver and designated vehicles. as well as wellness programs. And these programs are designed to promote the health and well-being of the whole person in one or more areas of intellectual, physical, social, vocational, emotional, and spiritual. Funds for this service are granted to several local senior centers to assist in providing these types of programs. And there are many other programs under Title III, for example, referral, assistance on getting individuals referred to other assistance, legal assistance, mental health assessment, as well as personal care assistant and respite. So here's another question for you. Which of the following programs is funded by the Farm Bill, which is reauthorized every 5 years? Is it WIC, SNAP and SNAP-Ed, Meals on Wheels, or the National School Lunch Program? Well, if you chose SNAP and SNAP-Ed, you are correct. So if you chose B, then the other programs are funded through ACTS, but the Older American Acts would be what would fund Meals on Wheels or a program like that. The Healthy, Hungry, Free Kids Act of 2010 is one of the acts that authorizes WIC, and the National School Lunch Act of 1946 is what started the National School Lunch Program. Here's another one. SNAP recipients can receive nutrition education through what program? Is it Title III? Nope, that's not that one. Is it WIC, SNAP-Ed, or Meals on Wheels? If you chose SNAP-Ed, you are correct. Title III is the primary location under the Older Americans Act where programs for the older adult is funded. But WIC is a special supplemental nutrition program for women, infants, and children. And Meals on Wheels is an example of the program funded by the OAA under Title III for home-delivered meals. So SNAP-Ed is the program that would provide education to SNAP participants. So now we'd like to talk about some strategies for being an effective advocate. We've learned in the beginning with our conversation with Austin and Sharon that advocacy is a nutrition and dietetics professional responsibility. So much that the Academy has provided a toolkit to help registered dietitians, DTRs, and those members of the Academy to become better advocates. And so please feel free to connect to the Grassroots Advocacy Toolkit that is linked here. But in order to achieve the goal for a healthy nation, it's imperative that we work closely with legislators and policy leaders at every government level to promote benefits of nutrition and dietetic services. So take advantage of becoming an advocate and learning more about it. But let's go through a few tips and tricks in the next few slides. So what, where, and how to talk the talk. So some communication strategies in order for us to talk with legislators. Here's a few examples of how to be have an effective communication. We're going to go through some of these in the next few slides. First of all, action alerts. It was mentioned in the conversation in the beginning about what action alerts are. But if you scan this QR code, this is going to take you right to the Eat Right Action Center. And the action alerts are going to highlight policy issues that the Academy recognize as a priority. And by participating in an action alert, you can easily draw attention to these policies to members of Congress, which will help raise awareness. The action alerts are available for the Academy members and non-members, and it's an easy, quick, and very direct way to connect with your state legislators. If we connected right to the Eat Right, we'll do that in a few minutes, you'll see that the other thing that action alerts provide you is an ongoing report of what the Academy will determine as priority, and that will help as you develop your conversations with your legislators. Through action alerts, you can find out who your legislators are in your state, and you will be put in contact with their office. So this is great. This will give you an easy way to find out who you can speak with and how you can contact them, whether it's your representative at the House or if it's your senator. And by having their contact information, a good first step in communicating is an email. And the email is one of the most effective ways to communicate with your elected officials. Many of them already have a communication program set up so that you can send an email directly to them. But you want to be able, when you are crafting an email, you want it to be professional, formal, with as you are writing a formal written letter, with a formal salutation and the right professional language. In addition, the additional advantage of the email is that it's very easy to include your state policy leaders as well as academy staff on any of your communications if you wanted to copy others in the communication. So here's an example of a sample email, and if you read through it, you'll notice something about some talking points. And when we say talking points, it's really what we want to bring across to the representative. So we have a general agenda, so to speak, on why we're writing, or maybe why we are contacting them. If you read through this, do you see any particular talking point in this email? Perhaps you read this. This is an area of the author was saying that she was interested, or he was interested, in the legislative priorities that aim to reduce healthcare cost and improve the health of Americans through food and nutrition. So this is a nice introduction to what areas of the legislature should be alerted to if you arrange to speak with them. If you follow up with your email with a meeting, then you can go into more details about those programs, such as SNAP or WIC or Title III programs of the OAA. And but there is a second talking point here. If you read further, perhaps you pick this up here. This is in part of the email where there's a mention of who we are, how dietitians are working to accomplish these goals and improving health and reducing costs. So these meetings and communications are are key times to promote not only legislation, but also us, who we are, explaining who and what we do, as we had talked about before. A formal letter is always another way to be a good advocate. This is another nice way to communicate with district officers as well as other legislators. And it also gives a nice chance to remind them. Perhaps you follow up with a formal letter after you have done an email. A phone call is another way to communicate with the legislative office and usually is used to schedule an initial meeting or stay in touch with their staff members. And once you make that connection, they would like to, most staff members are going to ask you for your contact information so that they can give you a call, and you can encourage them to use you as a trusted source of nutrition information whenever a nutrition issue arises. So here's a sample script for a phone call that can be utilized with the talk to a legislator. You can see that there are similar talking points that were in the email. But again, have a script ready or have your points of talking points ready so that when you have the conversation, you're ready, you can be specific and you can lead the conversation. A meet and greet is a reception in which a person socializes with a group of people or guests, or you can have a one-on-one meeting with the legislator. You can certainly go to their office, but in these times, a Zoom conversation can happen very, very easily. So be prepared for having that one-on-one conversation, and also, or whether it's Zoom or another teleconferencing platform. But there are some key points that we would want you to remember when you are getting ready to meet and greet a legislator. First of all, prepare those talking points. Get in mind exactly what you would like to speak about. Is it a particular act? Is it a particular part of an act, like say Title III? Or is there a particular section of a bill that's being proposed that you would like to emphasize? Be ready with the names and the names of the legislation that you're interested in. For example, the Nutrition and Dietetics Act or the CARE Act, as we looked at congress.gov. That's an excellent talking point, and that could take up your whole entire phone call or your Zoom call. But there's more. You can also talk to them about the importance of nutrition and the registered dietitian. So become familiar with the legislation that you'd like to speak of. Use evidence and research, but not too overwhelming. You don't want to give them lots and lots of research articles, which is going to just sort of probably get pushed aside. Use simple language, but direct. Use pros and cons and an anticipated cost of whether it's a cost improvement or or if there's going to be cost of the bill for a particular program. But also have ready personal examples of the impact that you have made on individuals as a registered dietitian. Personal and anecdotal stories are very effective when you are speaking with the legislator, whether it's live one-on-one or whether it's on Zoom or even through an email, a regular email connection. Sharon and Austin also talked about a site visit and letting legislators have an on-site visit on where you work. Let them see what you do and share with the members of Congress, give them a hands-on experience. This allows Congress members to learn about the essential nutrition programs and policies that impact their constituents and communities. Remember, they're representing a lot of people, and that's who they need to please. And if you are treating their constituents, then they need to know. Taking a Congress member to work shows commitment, value, and impact that the RD has on the dietetic in the community. Another way to advocate is using social media as a platform to inform the public and how an advocacy contribution can help the community. It's a great way to generate interest in legislation at the local or the national level. If you use social media, you want to first choose the type, whether it's Twitter, Facebook, Instagram. But when you do, there's some sample posts here. Be specific. Name an actual bill or piece of legislation. Maybe include a website for more information or a hashtag so it's able to spread the word throughout the social media. But keep your message simple but strong. And there's some sample posts here to help you out. Okay, another question for you. What is your best initial strategy to communicate with your legislator regarding a concern? Should you arrange a site visit? Should you send an email? Should you arrange a meet and greet? Or should you go right into social media? Perhaps you got this right. We recommend you sending an email or using electronic email to start your conversation. Action alerts are a great way to get started so that you can, again, make that connection with who your representative is, as well as start the electronic communication so that you can arrange a site visit or arrange a meet and greet, and also become more familiar with their social media as well, so that you can perhaps influence and spread the word on specific policies as well. So here are some steps in conducting an effective meeting with the legislator, and some of this we've talked about, so I'm just going to, these are sort of points to remember, but you want to be brief, clear, accurate, persuasive, timely, persistent, grateful, and polite. That sounds like a lot, but it's very important for you to be ready, in other words. Try not to be polite, but be on time, but also be ready to have the conversation. But don't be afraid to say I don't know when asked a question, and just remember to promptly follow up with that information if you do. You want to remember names and thank them for those who help you, both in the legislature and in the public health advocacy community. And be sure to follow up the legislator with a thank you call, email, or letter. Another idea that's not on this list is to provide a card or provide some kind of handout for the legislator to have so that they are reminded of who you are and what you discussed. Now, how can we gain influence? Well, we can do that through offering to work on their campaigns. We can offer to provide mini internships for legislators. So perhaps you had a site visit and they enjoyed that. So offer it to more, and so that you can have more legislators come and see what you do. Attend a public forum. Identify fellow advocates or partners. Acquaint yourself with staff members for legislative committees, and also for those who are at the Capitol or at the local districts. Finally, you don't want to overload the conversation or the interaction with them with lots of research articles. You want to know your evidence, but be specific. You do not want to give vague recommendations, and you don't want to give any expert opinion of something that you are unsure of. You also do not want to use jargon or confusing statistics or things that you know that they may not understand. You don't want to threaten or make promises you can't keep, and you don't want to pretend to have more influence than you really have. So finally, let's take some action now. Let your voice be heard. Link here to connect to the Eat Right Pro Action Center. The Academy helps with providing action alert emails so that you are made aware of key legislation that is currently being discussed in the House or Senate, and what legislator can be contacted to help your voice be heard. So if you link here, you will be taken to the Action Center. If you're logged into your Eat Right Pro, you'll be taken to the Action Center, and you'll see that action alerts are available for members as well as for non-members. And if you click on for members, you'll see that when you click in here, you're going to see already the Academy's prioritization of nutrition policy. So here are some individual information for about the particular acts and bills that are being currently discussed. As you know, we already checked congress.gov, so we know that we are going to have bills that are in place to improve nutrition funding. So this is one that is a priority. Promoting diversity in allied health professions, telling our senators to co-sponsor a school food service modernization act, expanding MNT for eating disorders, which we looked at already in Congress, in congress.gov, and then also supporting Medicare coverage for intensival behavior therapy for obesity. So these, on this particular day, these are the priorities that the Academy is recommending for us. And as you click on this, you would be taken to an email program that would connect you with your personal legislator. So once you fill out your personal information, including your zip code, you take note of those legislators and you click send, and then you're in the loop. So finally, we're just going to leave you with some more resources. There have been plenty within the slides, but here are a few more to help you make that connection to the Eat Right Pro Advocacy resource page, and there are others. These are a few other references for you. And finally, we thank you and we wish you the very best as you become a stronger advocates for yourself, your clients, and the community. Thank you.